Ladies and gentlemen, you would have noticed that Georgetown continues to be the epicenter of the COVID-19 pandemic, and most of those who have tested positive to date are males with a ratio of 49 to 44. Further, it is predominantly clear that you are the main ones not adhering to the guidelines, congregating way past the curfew hours as if it were a prolonged holiday. Have you stopped to think of the unnecessary risk that you are exposing your children, your wife, significant others, your mother or grandmother to? Yes, you're exposing your entire family. As one male to another, I am pleading with you to do the practicable thing, which is to stay home and to be off the roadway. Do not think for one moment that you are invincible and that the virus cannot affect you because your area has not been identified as a COVID-19 hotspot. All of us are at risk, and the only way that we can stop these numbers from increasing and persons from dying is if you seriously follow all the advice that has been given. If you must leave home, then it is a no-no to go unprotected. You must put on your mask and keep the 6 feet physical distance. Ladies and gentlemen, we have been appealing to you to come forward if you have been in contact with a positive case or experiencing any of the symptoms associated with COVID-19. If you arrive at our facility at an advanced stage of the disease, you're placing yourself at a disadvantage, and there may be very little that we can do to save your life. Some of you continue to provide incorrect information, making the contact tracing very challenging for us. We understand the fear of being isolated or hospitalized, the stigma and discrimination, but we cannot contain this disease unless we receive accurate information. My fellow Guyanese, it is imperative that we find those persons in our community as soon as possible who can spread COVID-19 without even realizing it. We are pleading with you to access the mobile units when they come to your community. You must test your contacts and the contacts of their contacts. We must conduct tests in our hotspot areas to uncover the symptomatic and asymptomatic persons. Testing is critical if we are to contain this disease and flatten the curve. Today in our country, we are reporting no new cases of the additional 34 tests done. The total number of confirmed cases remain at 93.